Before we get started, please remember this podcast is for general educational purposes only. We're not providing medical advice, diagnosis, or treatment. Always consult your own healthcare provider about your care. Welcome to Fertility Nurses Unfiltered. 2 nurses, 1 mic, no bullshit.
I'm Ashley LaRue, fertility nurse and founder of Fertility.
And I'm Laura Wepler, fertility nurse and founder of Navigating Fertility with Laura.
You got questions, the internet has a lot of opinions, but what you really need is 2 fertility nurses who aren't afraid to tell the truth.
No scripts, no sugarcoating, just honest, evidence-based nurse-to-nurse conversation. So let's get into it.
Hey everyone, welcome back to this week's episode of Fertility Nurses Unfiltered. As always, Laura and I are so happy to be here with you. This episode is honestly long overdue. Male factor infertility is something we've been wanting to dig into for quite some time, and Father's Day felt like the perfect moment to finally do it. So today we'll be diving into the physical and the medical side of male infertility, the bias and misconceptions that have kept this conversation in the shadows, the emotional reality of navigating fertility as a man or as a partner, because if you're still in the thick of it, Father's Day can hit a little differently. But to have this conversation the right way, we wanted someone with both the clinical expertise and the personal experience. And I happen to know today's guest from back when he was first opening the doors at CCRM Miami, so this one feels extra special. Our guest today is Dr. Callum Potts. Dr. Potts is the founder and medical director of CCRM Fertility Miami. He's a board certified in OBGYN and fellowship trained in reproductive endocrinology, with one of his many specialties being male factor infertility. He's a Castle Connolly top doctor, an ACOG member, but what truly sets him apart and that doesn't appear on a resume is him and his partner faced infertility firsthand, and today they are proud parents of twin boys born through IVF. So he knows what it's like to sit on both sides of the table, and that is exactly why he's the perfect person to chat with us today. So Dr. Potts, welcome. Thank you so much for taking time out of your busy schedule to join us, and we're so happy to have you on.
Thank you so much for having me. I appreciate the invitation. Great to chat.
Awesome. So let's just start with, do you mind just kind of sharing your story, how you got into fertility, what made you interested in that from a professional standpoint? And then I guess that kind of blends with your personal experience and sharing as much or as little as you would like.
Yeah, sure. So as you probably would have been able to tell at some point, I am Australian. I was born in Australia, grew up there, did medical school and some training there. Found out or realized at some point midway through my teenage years that I should not have been Australian. I should have been American, and needed to change that at some point. So came over here for the rest of training, did OBGYN residency, got into infertility after that. And I think that the draw card is just, it's like, by and large, it's a very positive specialty. There's a lot of aspects of medicine that are a little more chronic, and you're kind of managing exacerbations of long-term conditions, and the impact that you have is incredibly meaningful. But you're making small aggregated gains, and I think in OBGYN and fertility specifically, you have this like wonderful window of opportunity to really change the course of someone's life or a couple's life. And one of the things we always say is, like, it may not look like the journey that you expected, but there's always a way to have a family. And whatever we can do on our side of the table to kind of help with that is incredibly like rewarding from my side. And it's just a really cool specialty. Like what we have available now is so much more than what we had available 5-10 years ago. There's all sorts of things that are happening. Like, technology changes rapidly, and what we are able to offer people is improving significantly all the time. So it's an exciting kind of field to be in and be able to be a part of. And I guess so the personal piece of this, I think not uncommon for couples, not uncommon for people in medicine. When my partner and I decided to start building our own family, didn't happen as easily as we expected it to. Stopped birth control when I was in fellowship, probably halfway through training. Had a miscarriage fairly quickly, and then nothing. And it's very confusing. You're kind of told your whole life, hey, avoid pregnancy, do everything you can. It's really, you swim in a public pool and something bad's going to happen, right? And then like when you stop, everything seems normal, you're healthy, and nothing's really happening in the way that you expect, or the timeline that you expect. And for us, we had ultimately, an unexplained infertility diagnosis. And every month of like having starting a period and having therefore a negative pregnancy test and starting again, became sort of emotionally taxing. And so for us, being a little bit more in the field than maybe the average patient, we jumped straight to IVF. It made sense for us. It doesn't always make sense for everyone. Everyone's personal journey to treatment is very, very different. And so for us, that made sense, and very fortunate that we did. Got our two beautiful boys out of that. Origin story for being here in Miami is that, I was in Vermont for a fellowship, had a colleague who went to work at the CCRM location in Boston. And you kind of know when you're in the field, like, okay, great, there are places that do things pretty well. CCRM has a really good reputation from a lab side. So felt very comfortable going to see her and had a great experience. And so when we moved to South Florida, it was, okay, let's try and work in a place that gave us the experience that we had as patients. And the natural solution to that was working for CCRM down here.
I love it. I'm curious because we hear so much frustration from patients about having a diagnosis of unexplained infertility. And I think for those of us who have been in the medical field, like we want to know why for everything. And I just wonder, like, how did that feel? Like, I imagine it was very frustrating not being able to figure out exactly what was the issue.
Yeah, I think frustration is the key point of that. It's not uncommon, right? Like 25-30% of couples with infertility get this unexplained infertility diagnosis. And it's not that there is no explanation for it. It's just medicine is imperfect and testing is imperfect. And there are probably lots of subtle things that are happening in the background that we just have no ability to test for, that are all conspiring to make it more and more difficult to conceive a pregnancy every month. There's almost nothing in the fertility sort of testing space that will say you absolutely can or absolutely cannot get pregnant. A lot of these factors are just sort of like, they modify how likely it is to happen. And for unexplained infertility, I think there's just a grouping of things that are making it more challenging to conceive. The positive side of it, which is hard to see when you're in it, but the positive side is all treatment options are available, right? Like there is sperm present, there are eggs present, the fallopian tubes are open, the uterus is there and structurally normal. So things can happen. It's just, it may not happen in the time frame that you're looking for, but that does mean that treatment options are open. So you can do IVF, you can do maybe medication, maybe IUI, and the outcomes tend to be pretty positive, which happily we're kind of on that side of the equation as well.
Yeah. Obviously you have a different lens coming into this as a partner going through this, but it is obviously still like you have to take your doctor hat off, and it is a still very personal thing that you're navigating. So how was it, again, you're going to have a different lens than a lot of people, but like navigating that, obviously you were during fellowship too. So a lot of personal stuff going on, not only, doing this, but also for your work and trying to get into this field. Like, and we just hear so many times, and we see a lot in this field of, partners potentially not being as present or wanting to do more or wanting to be more present or not sure what to ask, how to be, as supportive as possible. Can you speak to that a little bit on your side? Again, going to have a little different lens given you were in this specialty.
Yeah, I mean, and not like altogether a better experience. I think like it was fairly kind of disarming to be on the other side of the desk. And like, I was in the best possible scenario where I was at a great clinic and I knew the doctor and I knew much of the subject matter that we were talking about. But it's very like disempowering to sit there and have this prospective battery of tests that it's going to take you weeks and you have to time them all correctly, to go through the insurance rigmarole or the out-of-pocket sort of expense of all of that, and kind of just like the time frame from when you actively made the decision to go seek fertility care to then actively getting something that's going to improve your chances. It's daunting. And like before that experience, I guess, like, in my mind, I'm going through the doctor things. I'm, having the appointment, seeing patients, and kind of, running through things in a very sort of, I don't want to say mechanical way, but like, you're doing things in the way that you should to get the answers and get the treatment outcomes.
Mhm.
Being on the other side of that sucks. Like, you're just
Yeah.
like a passenger in the process. And there's a lot of complexity. There's a lot of moving pieces to fertility, all the tests, like all the financial stuff, the logistics, working with pharmacies, getting medication shipped, getting medications not shipped. Like, there's a bunch of stuff that was really kind of unexpected, and eye opening, and it's great to have had that experience. Honestly, like, it's nice to, you know, I can't solve all of those problems, but just get a little bit of a window, I guess, into the frustrations that come on the other side of the table.
Yeah.
Yeah, that was what I was gonna ask a little bit. Like, how is this maybe impacted the way that you practice as a physician, having been on the other side of it? I mean, I've had my own personal fertility journey, and then working in the clinic, and I always it's this weird thing. It's like I'm not happy I went through it. I would never want to go through that experience again, but I'm also grateful for the different perspective that it's given me as a nurse, to talk with patients and be able to put myself a little bit in their shoes and understand some of those feelings that they may be going through.
Yeah, no, I totally agree with that. This is a very emotionally fraught experience. Like, this is, for many people, kind of the first time that they're dealing with a medical condition, dealing with the medical community. For a lot of people, I guess it's maybe the first time that they have not, like, life has not gone as expected. You go through your education, you go through your professional career, you can have a lot of control over a lot of aspects of your life, and this is like the first time that doesn't feel true. And naturally, like, kind of emotions come out and come to the surface, and that's okay. Right? Like, and it's kind of nice to know what that feels like. Not I don't want anyone to be in this scenario, or to have done it myself, but it's kind of being able to meet people where they are, and knowing a little bit about what that feels like. Everyone's scenario is different, but it's been helpful to kind of contextualize individual journeys, and just how people are responding to the stresses that come with that.
Yeah.
I think it's so important for people in the community, providers, nurses, like us, to speak up about our journeys that we have potentially taken. We don't have to share a ton, but something
Mhm.
that Laura and I have talked about previously and with other guests on the podcast is, um, once patients do find out, even on the surface level, that you had your own journey, it's almost like they like exhale a little bit, like, oh my gosh, you get it. Like,
Mhm.
you don't even have to explain anymore. It's just like, you get it. It doesn't matter necessarily what that journey looked like. It's just you understand what it feels like to be on that other side.
Yeah.
And I think that makes such a difference. And I appreciate you talking about it, is especially as being a male in the fertility space. Like, I don't know if
Mhm.
we see that quite as much, just given it is
Mhm.
a relatively female dominated profession.
Yeah, and that it's kind of an interesting way of how the field has developed, right? Fertility is clearly a two-person process, but the vast majority of what drives successful pregnancy is from the female partner, and therefore, most people who do most of the fertility sort of face-to-face work are, like myself, OBGYNs by training, who then go into sort of this subspecialty to work specifically with infertility. The male side of it's incredibly important. And there is an entire branch of male fertility specialists. Like, reproductive urologists are also fellowship trained specifically in male fertility. But it's interesting the way that the field has developed, I guess, that
Yeah.
they're kind of, they shouldn't, but they may feel like they're an add-on service rather than like incredibly core component of what is a couple's fertility journey. And we lose a little bit with that as well. Like, I will be the first to admit, and happy to chat all things male fertility, but it's not my area of expertise, right? I'm not in that literature all the time. I'm not explicitly fellowship trained in that, and I can chat to folks about male fertility, but always sort of rely on the support and advice and evaluation and treatment of my reproductive urology colleagues. Interesting point you made earlier of like, how do you get male partners more involved? I mean, I think that's, I don't know, what maybe a symptom of or a cause of, or maybe it's a bit of a chicken and egg kind of thing, but male partners aren't always involved, which feels strange, right? Like, if you have a couple with infertility, 90% of the time, I think I speak with the female partner, if not exclusively, then at least for the new patient visit. For most of the visits, at some point, the male may come and be a part of the conversation, but it feels like, for whatever reason, the couple fertility journey is kind of driven largely by the female partner, and I wish there was a little bit more involvement, I guess, on the male partner side.
Yeah. I definitely agree with that, and I think I mean, I have this conversation with patients all the time, and and I don't want to overgeneralize, right? Because every male is different, every husband is different, every partner is different. But it almost seems a lot of times just the way that women and men process emotions and deal with, anxiety and stress are just very, very different. But I almost wonder, and I would love if you can speak to this at all, maybe take us into the mind of what's going on the male side when you are navigating a fertility journey, because I think to us as women, we feel like it's happening only to us because, again, we're the ones taking the shots, we're the ones going in for the ultrasounds. So, but I know there's such a male component, and obviously you see it too, depending on the couple. There's some very involved partners, but I would say the majority are not. I heard a joke from a comedian years ago that like men literally take their feelings and put them in boxes, and then they put those boxes in boxes, and like it's not like that for women.
No. You've got to just like push the emotions down on all the other emotions, and then just like put the lid on very quickly. It's. I mean, clearly there are men and women. Not to generalize. There's no absolute for either side, but like men tend to not see their physician, and they tend to not really engage in the health system at all, really. And that has its challenges, right? Like male health in general probably suffers for a complete, like almost lack of interest in seeking out medical attention. And that probably also feeds into the fertility journey. It's hard to get men into the clinic. Like you'll run through a barrage of tests from a fertility perspective, and 98% of them fall on the female side. And it's like, do a blood test on this day and do an ultrasound on this day and put a catheter here and stand on your head here and like all sorts of things. And 3 weeks later you come back and everything is done. And then from the male side, it's like, please come to the clinic at this time and produce a sperm specimen. And it's like, nope, can't do it. Too hard. Like it's really challenging. So it's frustrating. And look, again, I don't think it's for the most part a lack of care or interest. I think there's a lot that goes into like the male like reticence to seeking medical attention. And again, I think a large part of it comes from like, as a man, it's kind of a strange thing to go to a gynecology office and do really much of anything. And I think, our OBGYN colleagues and my OBGYN colleagues are the, coalface of infertility care. Like they are the people for whom female patients have the longest medical relationship. And, when fertility issues kind of come up, like that's the group of people that kind of get those questions most often. But it would be kind of out of the question for like a male partner to be at most of those appointments. So I think there's just a little bit of like a disconnect almost at the beginning of getting men involved in the conversation. And there's not really the male equivalent from a fertility conversation standpoint. Like a primary care physician's great, and they'll be the probably the first person that you could ask a question about as a man for your fertility testing, but it may not be the thing that they do very often. And so the direction may be a little bit less clear or a little bit less focused. And it really is often by the time, you're now say 12 months into infertility and you've done a bunch of tests with your OBGYN and we're now moving to the next step, which is going to like specialized reproductive care. This is the first time that a man has actually entered the conversation and become a part of it.
I think something that we're seeing more in the space, and I think it's just more companies are doing it, and I'm seeing it in like Reddit threads and things like that. To your point, they don't want to come into the office in an uncomfortable situation to give a sperm sample in this tiny room where people are walking down the hallway and, all these kind of things. So what we're seeing more and more are kind of at-home semen analysis. What are your like general thoughts? There may be better companies than other. We don't have to name them, but like in general, people are asking that question. So I would love your perspective as a fertility doctor. Like, are they worth it? Are they like, where do we kind of draw that line of, yes, the comfortability, but also getting accurate results, and people that are being proactive about testing, does it make sense to utilize them?
Yeah, I think it varies. There are definitely at-home tests that are not great, that don't really give you an awful lot of information, that probably aren't helpful at all to do. And there are others that actually do a really, really great job. So there are a couple of companies, and speaking their names out loud is definitely not an endorsement, but like Fellow, for example, is a company that has developed a at-home semen analysis kit where they'll send you the kit, you collect, you send it back to them, and they've done the research on sort of buffering the solution so that you get a valid result at the end of the day. I think there's value to that, right? Like it can be hard to get men into the clinic. It can be hard sometimes for men who travel for work all the time to actually find the time to come in and produce a specimen. Or it could be hard for someone who lives in a place where maybe fertility care is not so immediately available. And it's really great to be able to get something at your house to test your fertility, and what is half of the fertility process for a couple. Always, like if there is an abnormality on one of those at-home tests, I think it's valuable to repeat it in a fertility office, because you don't really know what happens once you collect and send the kit out, right? Like anything could happen on the truck on the way back to the factory. So I think there's value to them. I think it does break down some barriers, which is really helpful. And if we're trying to get male partners more involved earlier, kind of as soon as we start having the question or the discussion about, is this infertility process normal, or is our fertility journey normal? Let's do some testing to find out. This is a really, really easy way to get access to great quality information, usually about your male fertility status.
Yeah, and it seems like probably, I mean, I don't know how much it costs to do that, but I would imagine it's relatively inexpensive compared to fertility treatments. And it could maybe be a little empowering for couples to be able to just, if they're already nervous about it, right? We can do this at-home semen analysis. We can do some, monitoring of natural cycles, and maybe get a little bit of information without having to necessarily go straight to the fertility clinic. So I could definitely see the value. I've always heard people say, all right, I'm hearing more and more, I think, women out there saying, like, why don't men get semen analyses the same way that women get pap smears every year, right? Like, why are we not a little bit more proactive about male fertility?
Yeah, I mean, it's a good question. It's there's a lot of redundancy in male fertility, right? So, whereas from the female fertility standpoint, on a normal spontaneous cycle standpoint, one follicle grows, one egg gets released. That's the egg that either fertilizes and becomes an embryo or it doesn't. From the male side, men make like 100 million sperm a day, and so there's so much redundancy in male fertility that testing is imperfect. We really have the one and only test for male fertility, which is a semen analysis, and it tells us a little bit. It tells us about production. Like, you can look at what the volume of the specimen is. We need it to be a certain amount. We can see how many sperm there are per milliliter of semen that's collected, and it should be a certain amount. We can kind of see what percentage of them are moving, and a certain percent should move. And we can get this like total number of moving sperm in a specimen, and it should be at whatever the parameter is for that test, but it should be at a certain point, above which we feel fairly happy, below which maybe that's a reason to go in and see someone a little bit more quickly. But those numbers are not perfect. The numbers that we have for judging sperm production on a semen analysis are purely mathematically driven. It's you get 10,000 men, you get 10,000 semen specimens. The top 95% of results are normal, the bottom 5% are abnormal, and that's the line that we use to kind of gauge whether sperm production is normal or not. So what ends up happening is, yes, the higher likelihood is if your sperm count is lower, then you may have higher chances of infertility, and if it's higher, then you have better chances of fertility. But you can be infertile and have a completely normal semen analysis, and you can have a very abnormal semen analysis and be having spontaneous pregnancies, right? So I agree. I think it would be helpful to definitely have that sort of male fertility check-in more frequently. You're going to capture abnormalities more quickly, but it's not a panacea. Like, it's not the perfect test, unfortunately.
Yeah. No, that's a really good call out. It's information, but it's not the whole picture, right? but I also think information's power, and I think any way we can get males more involved and earlier,
Yeah.
it could potentially be, could be a good thing. You talked a little bit about semen analysis, which I think a lot of people are familiar with, and something that we're seeing more and more and more and more people talking about on social media, double-edged sword with social media, but we're seeing more and more about like DNA fragmentation. So can you kind of explain what is DNA fragmentation? How is that different? Who is really the person that would be sort of like maybe like the next test that you would look at?
Yeah. I mean, it sounds like it should be incredibly important, right? Like it basically, it's a sperm test that looks at the percent of sperm that have fragmented DNA. And so if sperm is the DNA delivery system to get that sperm DNA into the egg, if there's fragmentation and a higher degree of that, should be really, really impactful. As with lots of things that we develop as tests in our field, it hasn't necessarily turned out to be the case. There are really sort of two specific scenarios that a sperm DNA fragmentation index, or DFI, is valuable. One is for couples that have recurrent pregnancy losses. So for us, at least 2 pregnancy losses that is otherwise unexplained. That there isn't another medical reason why we think these losses are happening. There may be a component of sperm DNA fragmentation that's impacting embryo quality or embryo chromosomal status that is driving those losses. And the other big category is couples that have had a poorer than expected IVF outcome, which is vague and intentionally vague. And it could be maybe fertilization is lower than expected, maybe development of embryos is less than expected, maybe the percentage of embryos that are chromosomally normal is lower than expected. And again, there may be some sperm DNA component to that, but it hasn't really been found to be that useful from a just general infertility testing standpoint. Probably in much the same way that a semen analysis has its advantages and role, but hard to really make like huge conclusions from the results of that test.
With sperm DNA fragmentation, let's say the test is done and the sperm, the fragmentation's horrible, right? What do we actually do with that information, right? It's a little different than like, blocked tubes, and we know we have to do the IVF route. But what do we do when we have like a higher percentage of fragmented sperm, like DNA in the sperm?
So, I think helpful to think about just how sperm is being produced and like the timeline for that. Sperm production happens in testicles, and it takes about 90 days to go from like sperm stem cells down to sperm in an ejaculate that actually can achieve a pregnancy. The first 72 days of production happen in the testicles, and it involves sort of lots of division steps and development and maturation. And then they go on the transit. Sperm, when they leave the testicles, are immature. They kind of have to go through a structure called the epididymis, which allows them to pick up a bunch of factors that make them motile and capable of then getting to an egg and fertilizing it. And it's somewhere in that transit that DNA fragmentation seems to be acquired. So the two ways that you can kind of get around that, if DNA fragmentation is high, if we think it's impacting either pregnancy losses or IVF outcomes or pregnancy outcomes, you could take sperm directly from the testicles, because at that point they haven't really had that exposure to damage their DNA. You can do surgical sperm extraction, where you're poking some form of a needle into the testicles and extracting sperm directly from them. Or you can reduce the abstinence time and reduce the time that the transit is taking, and therefore reducing the insults that are driving that DNA fragmentation. And that basically just means ejaculating more frequently before you produce a specimen for a fertility treatment. And both seem to be equally effective. And if you present both options to men, either we're going to poke needles into your testicles to take sperm out, or most men choose the second option.
For sure.
I would think so.
I mean, thinking about that, let's say we have a normal semen analysis, and somebody's going to do IVF. Would it make sense just to counsel ahead of time to maybe have more frequent ejaculation prior to an IVF cycle to, presuming maybe there's a problem, maybe there's not, but we know you have a normal semen analysis, so let's just more frequent ejaculation before
I don't think that's bad advice at all, honestly. Like the classic advice for any kind of collection is please have 2 to 5 days worth of abstinence in the lead up to collecting the specimen. And that's valuable from an analysis standpoint. Like, if we want to make sure that we're getting a really good sense of what sperm production looks like, we don't want the abstinence time to be too long, because there can be sort of degradation of sperm quality if it's longer than 5 days. And we don't want it to be too short because there can be just a reduction in the volume or the concentration. Like the numbers may look a little bit lower if the abstinence time is too short. So that window of time makes sense if you're trying to get a good sense of like the actual production of sperm. But if you're doing something like IVF, you only need either tens of thousands of sperm or like tens of sperm. Like if you're doing the procedure called ICSI, where you're taking one sperm and injecting it directly into an egg to allow fertilization to happen, you don't need 100 million sperm. You just need as many sperm as you have eggs. And that's maybe 5 or 15 or 25. So it kind of doesn't matter if sperm production's much lower. If you normally make 100 million sperm and you've done this more frequent ejaculation process and now you have 15 million sperm, still more than enough to fertilize eggs from an IVF standpoint. Probably does make sense to a large extent to just do that. Not a great deal of data behind that, but it's not a for the most part, especially if sperm production is normal leading up to a cycle, it's probably still a very, very valid thing to do.
Yeah, not harmful, but could be helpful. And
exactly.
Yeah. You hit on a really important point that I think a lot of people get stuck on. So, and something we've talked on the podcast, like women are born with the number of eggs that we have in our lifetime, age, we lose those genetically, all those kinds of things. For men, they're creating sperm approximately every 90 days. You get sort of a new cohort. And I think there's, again, social media, I hate to bring it up, but like there's all these things that are trying to like sell people on like, do this, take this, all these things to like, you can improve your sperm quality here, here, and here. Like, can you speak to like what actually could improve sperm quality? Yes, you're continually making it. If somebody's like, semen analysis wasn't great, maybe we don't even know, and they're just like, I want to be proactive.
Yeah.
What can someone actually do that's evidence-based that can actually improve sperm quality?
Yeah. There's frustratingly little, honestly, for like female fertility, for male fertility, for egg quality and production, for sperm quality and production. There's a lot of stuff out there. Like there's a ton of supplements. There's a ton of like, diets and exercise regimens and, exclusionary diets and things like that. There's really very little data to say that many or any of those things actually improve outcomes. There are things we know definitively harm sperm production. So cigarette smoking is bad. Probably not the right time to start smoking if you're trying to have a pregnancy. We know that recreational drugs can have an impact, but there's a lot less data on that than you would imagine. So marijuana is kind of the big one. There's some associations with lower sperm motility. There are some associations with like more constant or chronic use or using it at least 4 times in a week and maybe higher risk for partner miscarriage. So maybe there's an impact on sperm quality. Again, less impact, less data than I would really like to have to make that counseling. We know that heat is really important. So, men have external reproductive organs, and that's significant because, sperm need to be produced within a certain temperature range. And when that temperature goes up, sperm production drops. And a lot of guys are doing other health things like frequent saunas and hot tubs and maybe road cycling where you're on the road and you're lycra for 10 hours a week. And that's all really good from a general health standpoint, but anything that's going to like consistently ambiently raise the temperature of the scrotum is going to drop sperm production to a fairly significant degree. I think the challenging thing is that it's such a variable impact. So there are men who smoke who have completely normal semen analyses, and there are men who sit in the sauna an hour a day and they have completely normal semen analyses. I think if you're going to proactively make those changes, great. But to your point earlier, Laura, it's like it would be nice to be able to kind of check in on sperm production and do those tests more comfortably at home more frequently so that you can kind of get a sense of like, is there something wrong? Do I need to start making these changes, or is what I'm doing right now kind of okay from a sperm production standpoint?
I had so many thoughts that just came into my head right now. I mean, one of them just like, and this just speaks to the broader, fertility, is that I think patients get really hung up on what can I do? What can I do? What can I do? And as you said, I think in both the male and the female side, we're so focused on what can we do to improve quality when we know there's so much we could do to worsen quality, right? All the things that you just named and more. Other than like stopping those things, and some of them the damage has already been done, but other than that, there's not a whole lot of things. But I think, as Ashley was saying, social media likes to make us think that there are so many things that we can do. And I mean, to state the obvious, it's because that's where the money is.
And to take like a really naive, like positive view on the world, it's not. Maybe it's because we want to have control, right? Like
Yes.
it's
Yeah.
this is such again a disempowering process, and it naturally you're going to want to do anything that you can in your power to improve outcomes. And the dark side of that is that people can take advantage of that, and there is a lot of money in selling things to people who just desperately want to start their family, and I think there's some danger to that. The best things we can do, I guess, are just the boring doctor things, right? Like it's not smoking cigarettes, it's being metabolically healthy. There's no specific diet that has a specific fertility improvement, but if you're keeping your body mass index within a healthy range, and you're eating a healthy balanced diet, and you're exercising regularly, moderate activity 4 days a week, like all of that is kind of the best we can do. If you're keeping the rest of your body healthy, then you're probably giving your fertility the best chance of being successful as well. The one thing, and I never saw this when I was in Vermont, but I see this an awful lot now that I'm in Miami, is men are using a lot of supplements that can drive down fertility, and they're not always marketed that way. So testosterone replacement therapy is incredibly common here, and probably in a lot of places. And it's increasingly common because there's this increasing focus or awareness, at least, of maybe male fatigue related to low testosterone levels. And the easiest way to kind of replace that is to take testosterone. And the downside is, if you're taking testosterone externally and your body sees enough of it, testosterone is an incredibly important hormone within your testicles to make sperm. But if your body is getting enough of it through an injection, then your body stops making it. So sperm production suffers. Sometimes it completely disappears. And I can't think of the number of times where we've been having like a 45-minute conversation, and now the male partner's time comes, and it's like, well, let's go through your medical history. And then, are you taking medication? No, not really. Are you taking any supplements? No, not really. Are you taking testosterone? Oh yeah, I've been taking that for like 2.5 years, but don't worry, I'm on the dose that my doctor gave me the medication that doesn't hurt your sperm. I'm like, okay, let's test that. And it's hugely impactful. And I think there's this, the challenge is, like, male fertility rates seem to be going down, probably in part because male testosterone rates seem to be going down. And the natural balance of that is, we'll take testosterone, and unfortunately that has a huge negative impact on our fertility outcomes.
I think that's such the opposite of what we think of, right? Like, oh, if I'm feeling fatigued and my testosterone's low, and I just need to take more testosterone,
Yep.
and that's going to improve it, right? And it's such like a mind, especially for people who don't know like the nuances, and it's completely mind-boggling. They think they're doing something correct and for their
Yeah.
fertility, or just for their general health and feeling better and muscles and all those things,
Yeah.
when really they've actually been harming their fertility this whole time. And that part's just not talked about enough when testosterone is given, or it's not counseled enough, maybe.
Yeah, totally agree. And there are, the great part of that is, there are like medical treatments that can both improve testosterone levels and do so in a way that doesn't harm fertility, and in many cases sort of boosts fertility. So, medications that are the same sort of medications we use for female partners, like Clomid and anastrozole, FSH, HCG, like all the same medications that work in the reproductive axis in the females, we have the same axis in the males, and so they do the same things, just on a different end organ. And those medications can increase testosterone and also can increase sperm production. And so, often it's a first-line treatment for guys who have lower sperm production. Clomid, in the right circumstance, can drive that and can kind of help boost that. So you get the dual benefit. But it's for whatever reason, again, that there seems to be this like push more towards doing testosterone therapy. It's the easier way to do it, and it's not that that's a bad thing. It's just, for this specific circumstance, it can be really, really damaging.
Yeah. Can you debunk something for us? I think something that we see in the fertility space a lot is, we talk about age a lot in the female, because again, females are born with the number of eggs they're going to have. We progressively lose them. The quality of them goes down, all that kind of stuff. Okay. Men create sperm almost for pretty much their entire lives.
Yeah.
And so you see this, and then we see people, famous people, celebrities having kids at 60 and things like that. And I think people are like, does age matter for the men?
Yes, um, probably to a lesser extent. Like we see a much more predictable and definitive impact of like female age on fertility. And as you said, it's the dual challenge of like over time, the number of eggs we have will gradually decline. Can start at a different point and can change, at a different rate for everyone. But over time, everyone will have sort of depletion of their ovarian reserve, and egg quality changes, and that impacts the ability for an egg to meet with sperm and make an embryo that is chromosomally normal. And that seems to be quite predictable. Like we are able to say, well, at 30 years old, 35 years old, 40 years old, 45 years old, like there are fairly predictable and consistent percentages of embryos that we make that are chromosomally normal. For men, it's a lot trickier. So there are definitely associations with increasing paternal age and infertility, like poor fertility outcomes. Whether that's at 45 years old or 50 or 55 years old, it's a little bit unclear. There's probably increasing sperm DNA fragmentation as time goes on, and I think that probably has a part to play, even if we're not really testing that necessarily the best way that we can right now. And there are increased associations with certain health conditions as well. So for like older paternal age, there's increased risks for things like autism spectrum disorders, for certain psychiatric conditions like schizophrenia, for some genetic conditions, sort of musculoskeletal conditions. There are single gene defect conditions that are much higher frequency for men who are older. So there are some associations. It's just it's a lot less direct, and we have again frustratingly little knowledge about male fertility and the ability to test for that stuff.
That's so interesting. I did not know that. And I think that's probably surprising for some of our listeners to hear too. I had no idea. I mean,
Yeah.
it's like you said, it's not as evident, right? Because we know with women, it's like we have chromosomally abnormal embryos results in miscarriage. But if you have a pregnancy and it carries on, and then potentially you do have a child affected with one of those conditions, right?
Mm-hmm.
How do you go back and say, well, yeah, it was because you got an old guy with old sperm?
Yeah, and I've had the question a couple of times of like, hey, like my partner's 42. He froze sperm when he was like 35. Should we use that instead of his now old 42-year-old sperm? And I have less of a like. There's less data than I would like to be able to answer that question. Like I think probably if you froze sperm at 35 and now you're 65, yeah, maybe there's a reason to use that sperm that you froze previously. But again, there's less of a direct link, right? You see men that are having children in their 80s, notable celebrities recently doing that. So it's clearly possible, and that there are maybe increased risks, but again, maybe not as like immediately obvious or quite as higher frequency as you would expect to see.
That's a really interesting point, talking about somebody freezing their sperm. Like we don't talk about that a lot, right? Like we talk about egg freezing, given again, numbers decline with age, quality declines with age. We know a lot about that, but we don't hear about sperm freezing quite so much. Like when do you feel like, I mean, there's certain scenarios, cancer being one of them, like oncofertility type situations, certain genetic conditions, potentially freezing. Obviously there's, for if the partner travels a lot, like we talk about all these like pretty common things with freezing, but like, is there ever a opportunity or where we should be talking about that more, given declines we're seeing in sperm quantities and things like you know what I mean? Like it seems like a relatively inexpensive, you got to pay for storage fees and things like that.
Yeah.
But it's way more inexpensive than an egg freezing cycle to have that and just have it on hand if you would ever need it in the future, because you never know what's going to happen. I don't know. That's an interesting conversation.
I think for the most part, for most people, it's probably not something that's necessary to do. If money were no issue and you had all the resources in the world, okay, great, absolutely makes sense to freeze some sperm and just have it as a backup. But again, because there's less of that sort of like expected age-related decline in sperm production, even if there is a decline in sperm production, like the wonderful part about IVF is now we have the ability to treat men who have very, very severe male factor infertility with incredibly low sperm counts or incredibly low motility, because we can just pick up one sperm and put it directly into one egg for fertilization to happen. So even if sperm production is incredibly low, it's still feasible to get pregnant. So I think for the most part, for most couples, I think it probably doesn't make so much sense. But yeah, I think definitely worth a conversation with your provider.
You mentioned being in Miami and sort of seeing like the differences. Specifically, you mentioned testosterone, but Miami is an extremely culturally diverse part of the country. Like, do you see any other cultural differences, whether that's, lifestyle, whether that's just partner being involved? What do you see any other sort of like cultural differences that would be interesting to pinpoint?
I think, and there's probably many reasons, but South Florida probably similar to like LA, maybe New York to a certain extent. Like there's a lot of like of an aesthetic component to life, and a lot of people are doing things that are improving their physical self-worth and well-being and appearance. Testosterone is a part of that. Steroids are a part of that. The frequent sort of saunas and hot tubs and all of these things that are probably good in other sort of aspects of life explicitly have bad outcomes or bad impacts on fertility. I think for the most part though, men are pretty similar everywhere, and there is that same kind of, I guess, recalcitrance to get into the medical space. I think a lot of men kind of shut down when male fertility comes into the question. When you do sort of have a new diagnosis of male factor infertility, like either incredibly low sperm counts or no sperm whatsoever, men take it pretty hard. They're I think to your point before, like our female patients are kind of used to doing this. Like you go to your gynecologist every year and get your routine screening, and it's kind of more natural to talk about like reproductive cycles and menstrual cycles and fertility history and to do the tests. And for men, there's a little bit of an ignorance, either deliberate or not. And then once they get that fertility diagnosis or infertility diagnosis, like it's a huge hit to ego. I think men more than women to a lot of degrees, kind of see that infertility as a huge like personal impact, I guess. And the emotions that can come with that are then probably not explored in the way that we really should be exploring them as male partners.
Yeah, I saw something the other day that was talking about how male infertility or getting like male factor infertility diagnosis for people that have talked and talked about it and been open about it, it's like a hit to masculinity. It's a hit to their identity in a lot of ways. And I don't think we talk about the emotional side of male factor infertility enough, again, because men and women are processing things differently. They're going through this process differently. But yeah, I mean, I can imagine that. But then I also think, if you also like a place like Miami, LA, New York have this sort of like identity, even like in the like you're trying to look good and feel good and all the things, to have that also is like, especially when you're like, I'm doing all the things, or I feel like I'm doing all the things. And now I get this, and you're like, wait, I eat good. I'm a marathon runner, and I'm super healthy, and my BMI is good, and all these things. It's like, what?
Yeah, having like either a low sperm count or what commonly comes with that, like low testosterone, like it feels like a personal insult. I think a lot of the time, like it maybe more than a low ovarian reserve, it feels like a core component of masculinity is to have testosterone and to sort of be a healthy guy. And that it does impact men a lot. I think in most aspects of fertility, we're probably not talking about how it impacts our emotional status as much as we should, or maybe we don't have the resources to help support people going through that infertility journey. And I think that's especially true for men. And there's a small but kind of increasing group of people who are having that conversation, like guys who have gone through infertility problems and are sharing their experiences and having those like sort of shared conversations, and kind of having that ability to talk about your emotions in a way that you may not have been able to before. There was I don't know if you guys saw that, like the Netflix comedy special from Andrew Schultz, which I think was like a really, really huge blow for like men's fertility in a good way. Came out about a year ago, and basically he was talking about his fertility journey and how he had male factor infertility and all the stuff that comes with that. And the amount of people who like talked to me in the month afterwards of like, hey, did you see this comedy special? It's so good. Like we felt like we were going through the same thing he was. Like it was, we cried watching it. Like it was a yeah. I think there's such a lack of like ability for men to talk about fertility. There's just not enough spaces for them to do that. So to be able to have those shared spaces and talk in a fairly vulnerable way is super helpful.
Yeah, we see a lot of that on social media, and there's groups for women, and there's women talking about their stories online, but we don't see that too much from men. So I imagine like if maybe there was some more vocal people as on this Netflix documentary, like I imagine maybe we could get the conversation moving a little bit more.
Yeah, and helps to be able to kind of like you said, see other people's emotional journeys and their own fertility journeys. And it's also just like it's a reminder that you're a part of the process as well, and you probably should start getting yourself checked. Like to be able to kind of have that conversation more publicly present, I think would go a long way to making men feel like they should be a part of the journey a little bit more, and they should be kind of approaching their fertility with the same level of interest and intensity as maybe their female partners are.
Yeah. And thinking about them supporting each other and helping them support their partners, I think maybe that could be really helpful too. I saw it, I mean, it was around menopause, but I saw this documentary recently on menopause, and there was part of the documentary was a group of men who meet up on like a Sunday to have coffee and talk about like their wives going through this and how it's impacting them, and like supporting each other. And I'm like, that's really cool. Like we need stuff like that for men, I think, in the fertility space too, because certainly it's an impact to them. I mean, right? Sex becomes a chore. It's no longer fun, which I think is a big hit for a lot of men. And I imagine there's a lot more emotions underneath the surface that just are not being expressed, but they're there for sure.
Yeah. There's honestly, I mean, there's, again, I can't speak for everyone, but like there's a lot of guilt to that, right? So, if you have like male factor infertility, and it's not uncommon, like 40 or 50% of infertility, there is some male component to that. So it's a really, really huge driver of fertility challenges. To be the cause of infertility, and now to have your partner go through all of the things that they have to go through to have a baby together, right? Like if now your female partner has to go through 3 months worth of like testing and injections and basic procedures where they go under anesthesia and they have needles poked into their body, and you're kind of just there as like the guy who's the problem. Or even if you're not, if you're just kind of a part of the process, like that, I think there's a tremendous amount of like almost like guilt, like you're not contributing to this as much as your partner is. And it's tough. It's a tough thing to witness. Like I know it's way tough to actually go through it and be the person at the kind of getting all the injections, but I think there's a lot of like disempowerment, I think, from the male partner side. Again, that may be a part of why it's harder to get them into the clinic, because it's there's this almost like disconnect between what is happening from a fertility journey perspective and how they can be involved with that.
I'm really glad that you brought up that point, because I've honestly never sat and thought about it in that way, that if it is a purely male factor infertility, they're not the ones undergoing all of the medical treatments for it. Whereas if it's a female factor infertility, right, it's kind of like, okay, as the female, you're kind of a little bit more maybe empowered to like do all the things. But I've never really thought about it in that way, of the guilt that they might be feeling over having to now put their partner, or how they perceive putting their partner through, maybe an IVF journey, or even if it's not IVF, right?
Mm-hmm.
Yeah.
And it comes up a little bit. Like there are certain cases where men have no sperm at all in their ejaculate. but it's there in the testicles, and they need to undergo a procedure themselves to like extract that sperm directly from the testicles to then use an IVF. And it's kind of funny, like you see those guys, they often do that collection or that procedure on the morning of the egg retrieval. So they've just kind of gone through their own experience, and they're kind of coming with their ice pack and feeling sore and sorry for themselves. And they're like, oh, yeah, I have a much better idea of what you're going through now. Like now I can be a part of this shared pain and misery. And once the egg retrieval's done, we're going to go home and we're going to like sit on the couch and eat popcorn and like binge Netflix together for a little bit. Like,
I mean,
it's
that
almost
makes
like
It sounds
almost
great.
a relief that they've done some version of the same thing.
well, it almost makes me think of like women who have gone through labor and then they're like, just get a vasectomy, right? Just go get a vasectomy. I've labored these children. So yeah, it's kind of the same thing.
Yeah, I mean, I don't think any of this is talked about enough. And I think bringing up the sense of, and again, I'm going to overgeneralize here, obviously, but like men having that sense of control, the guilt, the almost like I've failed my relationship or my marriage, or we talked about having X amount of kids and now it's, oh my gosh, it's, may not happen because of me, whether, something you did or didn't do. Like it's just not talked about enough when, like you said, 40 to 50% of cases involve male factor infertility in some way.
Mm-hmm.
And it's just crazy that it's just not as talked about, and there aren't more resources for men navigating this, or even just couples together. I think there's a missing piece there. Like, yeah, you can go to couples therapy, and I think there are some people that do that, but I like Laura said, I think there's so many resources and groups and people talking about it from like the female side. There's not enough talking about the male side. Like, where are those groups and things where you can do something together, where we could join together and have conversations and meet other couples that are going through this? So again, it's not so segmented or one-sided when it really is a partnership creating that family.
Yeah, you're right.
As we sort of wrap up, I guess, the top of the hour here, I mean, this episode is going to air the Tuesday before Father's Day. We did talk about, we talked about Mother's Day, and it happened not that long ago. But yeah, I think, I guess from your own experience, and then Laura, I guess maybe like your husband too, as you guys were navigating, what can we do as partners, I guess, to potentially support each other? Because again, Mother's Day and then now Father's Day is coming up. Like, how do we support men on that time, on that day? Everybody's going to be different, obviously. So may want to talk about it, may not want to talk about it, may want to do something, may not want to do something. But there's a lot of people that are in the thick of it. There's a lot of people that have children, but maybe they're, it's a secondary infertility thing. And so they're grieving, like not being able to have the family that they desire. It looks different for everybody.
Mm-hmm.
But how do we still celebrate the dads in waiting, whatever that may look like for somebody, and knowing, this is a long question, knowing that men think about things differently and process things differently. So like Mother's Day, we can talk about, we had a conversation about that. How do we celebrate the men that are navigating this process, or the dads in waiting?
Yeah, I mean, I feel very fortunate that like my infertility journey had a happy ending. Did IVF, did a single embryo transfer, split into two. So now I have two sons as a result of that. And they're now 4.5 years old, and it's a blessing. Like it's every day I get to spend with them is incredible, and I feel very fortunate for that. I'll be honest, I'm not sure if like while we're going through the infertility journey, I would have been able to externally express like the feelings that come from not having that family when you really want it. And I think it's important to be mindful, and again, we always maybe we're overgeneralizing, but it's harder for men to talk about their feelings in a lot of ways, and it's maybe not the way that they want to express that or get that emotional support, but being supportive and I think as much as we possibly can, like infertility is no one's fault, right? Like, yes, there's male factor infertility and there's female factors for infertility, but you are not the reason for infertility. It's not your fault that that's happening.
Yes.
And sometimes it's helpful just to kind of be reminded of that, and that, look, at the end of the day, people like me exist, and the reproductive urologist exists explicitly because we have ways to help, and there are always sort of opportunities and avenues to get to building a family. And I really hope that, for all the dads in waiting out there, that you get there by next year. You get that to that point as soon as you possibly can.
I honestly, I can't even remember what that was like when we were going through. I mean, it was like 11 years ago now. My husband is the eternal optimist, so I imagine in his mind it was just, well, next year, right? But I'm willing to bet there was stuff under the surface that maybe we didn't talk about at the time. Because again, as we've overgeneralized, right? I mean, I certainly have, I think, encountered patients in my work in nursing and counseling patients through treatment. I think I've definitely encountered very, very in tune men with their feelings. And recently I spoke with a couple who, spoke of feeling isolated at events where there were baby showers or get-togethers with kids. And it was really refreshing to kind of hear from that perspective, because you don't always hear it from the male side. Because again, it's not, I think that's a good reminder for our audience. And just that, again, I think because men mask their feelings very well, it's important to be on this day probably a little bit extra mindful of how you're speaking to someone. And maybe don't ask them, hey, when are you having kids?
Yeah, stop.
The one question to avoid almost always.
Yes.
Yeah. I mean, I think that's an important point, is everybody's going to deal with the day or want to handle the day very differently. And I think it's all about communication, right?
Mm.
On both sides. Like, what do we do something this day? Do we not? Do you want to talk about it? Do you not? Like, just asking those questions. I think not asking the question, when are you having kids, but asking questions about how are you doing? Do you want to do something? Do you not want to do something? Do you want to acknowledge it? Do you not want to acknowledge it? And coming from a place of like support, or I'm just thinking of you during this day, right? It could be just as simple as that, and not trying to like fix whatever the situation may be. So
and not being as explicitly communicative about your feelings, it doesn't mean that you're not as involved in the emotional sort of
absolutely
Dr. Potts, we are at the top of the hour. We give all of our guests just an opportunity to just kind of give one final, impart some wisdom on our listeners in regard to this topic, or what you would just want to leave our listeners with. And then obviously, if people want to work with you and find you, how does someone do that?
Yeah, I mean, I think kind of going back to the very beginning of the conversation, I really enjoy being in this field because it feels like we're able to offer so much, right? Like, that every year there's new things, there's new increases in success rates, there's new technology. I think we have the capacity to help a lot, and there's a lot of stuff that's really exciting that's just around the corner. So, for anyone who has infertility, male fertility, infertility, or otherwise, don't lose hope, right? Like there's always a pathway to building a family, no matter what it looks like at the end of the day. Love my time here at CCRM in Miami. Anytime you wanted to have a conversation and chat to me about fertility or fertility preservation or having a baby or whatever the questions are, CCRM Miami website has the phone number, has an online booking system. Happy to connect anytime.
Amazing.
And I know Dr. Potts, and so whatever my 2 cents, I would highly recommend him. So if anybody is looking to have a conversation or just ask questions or any of the things, Dr. Potts is great. So would highly recommend. So thank you, Dr. Potts, for so much being here and having this conversation with us. To our listeners, as always, like, subscribe, share, comment. We want to hear from you. So please don't hesitate to reach out, and we will see you all next week.
We'll see you next week.
If this conversation resonated, like, comment, or subscribe, share, send us your questions. Nothing is off limits.
And wherever you are in your journey, know this: you deserve support that's real and human. Never forget to ask your questions, advocate louder, and remember, you're not crazy. Fertility is hard.
That's it for today's episode of Fertility Nurses Unfiltered. Thanks for spending your time with us today.
We'll see you next time.